Buenas noches, familia. My name is George Velez. I'm an independent insurance broker with Velez Health Broker. Today I'm going to talk about Medicare 101, and it's basically the world of Medicare and how I help seniors navigate the world of Medicare. I'm going to be talking about Medicare Advantage plans and Medicare Supplement plans. They're both great plans depending on that individual. A little bit about me. I was born in Colombia, raised in Miami. My wife and I have been together for 21 years, married for 21 years, and we got two wonderful kids. My daughter's in Kennesaw. She'll be graduating next semester. My son's a sophomore in high school. Now, a little bit about what I do and what my services I provide. I'm partnered with some of the top 100 carriers out there, like Humana, Anthem, Blue Cross Blue Shield. And my goal is to be able to help you find the best coverage at the most affordable price. A little bit of compliance issues just to make sure I get those out the way. This presentation is for educational purposes only. I am not going to be talking about any pricing or any specific plans at all. All the information you can find is in Medicare.gov. Let's talk about Medicare eligibility. Who's eligible to get Medicare? If you are turning 65 or 65 and older and you've worked for 10 or more years, or you're a spouse of someone that's been working for 10 or more years, then you qualify for Medicare. You can apply for Medicare 3 months before your 65th birthday, including your birthday. Add that into the 3 months, and then 3 months after you are able to apply for Medicare. So you have a 6-month gap between the 3 months before and 3 months after. If you're under 65 and you've been disabled for at least 2 years, you also qualify for Medicare. Now, if you're under 65 and you haven't met that 2-year gap, then you can apply for the Marketplace ACA. And then those who have chronic conditions like end-stage renal disease, ALS, and Lou Gehrig's disease, those individuals have the ability to apply for Medicare. Let's talk about original Medicare, Part A and Part B. This is the original when everything started. It's still available for individuals. It's probably not the best option for most people, but Part A is what covers your hospital stays, your skilled nursing facilities. There is a deductible of $1,484, and each year it may fluctuate up or down, typically up, and it has zero premium. So there's no charge for Part A. What I typically recommend, if you are approaching 65, but you are going to stay with your employer, you definitely want to apply for Part A. Now, Part B, this is what your doctor visits are covered. Part B covers your doctor visits, your outpatient care, your preventive services. It does have a co-insurance and it has co-payments. There is a $203 yearly deductible that you have to meet. The standard Part B premium is $148.50, which everyone has to pay, and it's typically deducted from your Social Security. This premium is income-based, so if you make more money, chances are you will have to pay more on that premium. What is MediGap? Now, this is your MediGap is your Medicare Supplements. This is your, what most people may know as F, G, and N. These plans fill in the coverage gap of Part A and Part B, that 20% co-insurance and the co-payments. It typically offers 100% medical coverage once that deductible is met. All supplement plans are identical and have the same coverage. So it doesn't matter which carrier you go with, most of them are going to have the same exact coverage. Now, why do I like this plan? This is one of my favorite plans and what most people would consider as the top tier plan or your Cadillac plan, right? There is a premium on the Medicare supplements. Each state's premiums are different, but let's assume that the premium is probably $150 on average. Could be more, could be less. But if it's $150 and then you pay that times the 12 months, add the $203 deductible that you have to meet, what you're going to pay for the whole year is $2,003. That's it. Everything else is covered 100%. All your doctor visits, your labs, hospital stays, and whatnot are all going to be covered 100%. Several different plans are offered. All offer the same coverage. The premiums vary widely. They all pretty much cover the same thing. Now, it does not cover prescription drugs. You do need to get a Plan D, and it does not cover dental, vision, or hearing. You need to get an additional coverage if you want dental, vision, and hearing. Now, Part D. Talking about that you need a prescription, you need Part D if you get a supplement. Now, Part D, there are several different Plan D options out there at each county. All Part D plans do have a premium, and there is the deductible, and they're all vary depending on the plan you get. It's recommended you review your Plan D each enrollment period. If you do not review your Plan D before December 7th, you're unable to change the plan, you may be stuck paying more for your prescriptions. Remember, there's a donut hole, or what's called a donut gap, or the donut hole. There's different, people know it differently. And this is that gap where once you've reached that deductible or you meet a certain quota, that the coverage, the prescription or the plan D will not cover a certain part, and then you have to come out of pocket for quite a bit. And then it's plan D is very confusing, where it covers a good chunk, and then once you reach a certain high limit of roughly $4,000, it stops covering it until you reach the catastrophic level around $7,000, and then the plan will pick up again and continue covering. Some options out there that I recommend people to use to help keep their drug plans low as possible is GoodRx. It's a great app you can download, and it'll help you find the lowest cost prescriptions depending on your location and which pharmacy you want to go to. Reminder, you can't combine Part D with GoodRx. Part C. Part C is your Medicare Advantage. This has more comprehensive coverage. It has additional options out there. It is heavily advertised by a lot of the carriers. In my personal opinion, these ads can be vague and misleading, adding to the confusion of Medicare to the consumers. If you fall into listening to that specific ad, chances are you call them, they're going to push the ad or the plan that suits that carrier. So not traditional Medicare, but it is managed care plans administered by the private insurance company approved by Medicare. You have to be enrolled in your Medicare Part A and B, and you must continue paying the premium for Plan B, which is $148.50. Remember, your Part B is $148.50, and you have to continue paying that regardless of supplement or advantage. There are several out-of-pocket limits, your maximum out-of-pocket that you have to reach for these plans, and they range anywhere from $4,000, $5,000, $6,000, $7,000, depending on the plan you get. All these plans have a star rating. I would recommend you stay with a high rating plan. Anything 4 and up is good. You're allowed to switch to a 5-star rating once per year between the dates of December 8th and November 30th. So if you're on a lower tier plan and you realize that you want a 5-star plan, you can switch to it anytime between December 8th and November 30th. Most of these plans offer prescription drugs, which is why most people tend to like it. It bundles in your prescription drugs and your dental, vision, and hearing. They have additional allowances that help you cover most of your dental and vision and hearing needs. Some of these plans have a payback for Part B premium, which help you with the premium for Part B of $148.50. A lot of these provide gym membership. A lot have one-way trips to doctor appointments. Some plans even offer adult daycare. Most provide an allowance for over-the-counter items. So some of these plans do have a magazine or online, or you can even go to some of their preferred pharmacies to use the over-the-counter items and use that allowance that is provided to you. To help you make a decision, some people prefer to have a peace of mind of having everything covered 100%. So unlike Medicare Supplement, where you need to have an additional Plan D for prescription, and it doesn't cover your dental, vision, and hearing, most people prefer to have the Medicare Advantage one-stop shop in the sense that it covers everything. Like I said, it has dental, vision, and hearing. It covers your doctor visits, and it covers your prescription drugs, Plan D. It's all bundled in together. Now, but keep in mind that you do have some co-insurances and co-payments that you got to meet, and your maximum out-of-pocket that you have to meet for the Medicare Advantage. Now, let's look at this chart. In this chart, you're going to see a comparison of the different options that are out there. We've talked about A and B already. A and B is your original Medicare. I feel like Medicare did a disjustice in somehow where it kept naming or kept adding the lettering for each as they grew and added additional plans. I think it added some confusion, adding F, G, and N, and there's so many other L and K and P out there, but I feel like it could have probably simplified it somehow. But regardless, it's there and it's functioning at the moment. Now, Plan A and B we've already discussed, and this is your basic plans. Those turning 65 or over 65 will be looking at the most popular plan, which is the G and sometimes N. I recommend those that are on F to also consider your Plan G. I know some people that are Plan F prefer Plan F because it covers everything, including your Plan B deductible of $203. But keep in mind, these plans are typically more expensive month to month, as your premium is more expensive than your Plan G. Oftentimes, you're paying that premium to be able to cover your $203 deductible. So although they're covering that $203 deductible, you're probably paying $500 over your Plan G premium. So it's always good to review and see if it's worth staying on that Plan F. Plan G, like I said, covers everything pretty much 100% once your deductible of $203 is met. And then your Plan N is very close to your Plan G. The difference is that it offers lower premiums, but you have a copay of about $20 for doctor visits, and ER visits are about $50. Some major medical illnesses may require additional copays. So although your Plan N premiums are lower than G, it does have some additional copays that you gotta meet. And then on to low income subsidy levels. If you are low income subsidy, you do qualify for certain additional support to help pay for your prescription drugs. Or if you need additional help and you qualify and you meet the qualifications, they may even cover your Medicare Part B deductible or your premium. And so there are different options out there. I will include some additional links to the description on my YouTube page, which will give you additional information and where to apply for these subsidies. All right, let's talk about enrollment period. Your special election period. You're eligible to change your plan within 2 months of qualifying special events like moving, or if maybe there was a change to your plan where your doctor's no longer covered or something, then you can go ahead and use this special election period to apply for a different plan. Your annual election period, as you can see in the calendar above, is a good time to evaluate your coverage and confirm that your current selections meet your healthcare needs. Then you have the Advantage election period. This is your January 1st time. Medicare Advantage plans holders are now allowed to switch to another Advantage plan from January 1st to March 31st. Advantage election period allows for you to change to another Medicare Advantage plan if the doctor is no longer covered or the drug plan is no longer proper. If you're on a D-SNP plan or a C-SNP plan, it allows you to change Medicare once per quarter. So if you're on a D-SNP or a C-SNP, you can change plans once per quarter. A D-SNP plan is a dual eligible plan. Those are the people who are on Medicaid. If you have Medicaid and Medicare, then you're dual eligible. And if you and then the C-SNP, those are the individuals that have a chronic or special needs plan if they have a chronic illness. All right, so let's recap here. So we have two options. You have your Medicare Advantage, right? Or you have Medicare Supplement. Now, the way I see Medicare Supplement is you pay ahead. You pay for what you want. You're paying a premium each month, but you're not getting any surprises. Now, the Medicare Advantage, the way I see that, that's pay as you go. So you don't have a premium, your doctor visits are free, but if you're going to go do any type of physical therapy, you have some type of inpatient, outpatient procedure, if you have labs, x-rays, and so on, you're going to have co-insurances and co-payments that you have to meet until you reach that maximum out-of-pocket, which can easily be anywhere around $6,000 to $7,000 for your maximum out-of-pocket deductible. Whereas with supplement, you probably, you just have that premium and your $200 deductible for the year. So it all depends on every individual. Some people prefer the zero premium, whereas other people prefer to just pay ahead and they can afford paying the premium. Now, let's talk about financial penalties. Part B, if you delay on Part B and delay enrolling in Part B and you don't have eligible coverage, you will get some type of penalty for not enrolling in Part B if you do not have eligible coverage, such as group insurance through a spouse or group insurance through your job. Part D, if you don't have eligible coverage through a spouse, through group insurance, and you fail to enroll to a Part D, you may have a lifetime penalty when you decide to enroll in Part D later on. If you have COBRA, when delaying Medicare for COBRA is not considered credible coverage. If you have COBRA, I urge you to drop your COBRA and enroll into Medicare. COBRA is not considered credible coverage. Then if you're low income, you will not be penalized for any of the eligible subsidies that I talked about before. So in other words, if you are low income and you decide to enroll, you delayed in your enrollment, they will waive any sort of penalty that you have. So let's talk about the final key points here. Dental coverage. If you're on a Medicare supplement, remember that you need to get additional dental coverage. Critical events. I offer critical event options, cancer, stroke, etc. that will help you for any of these events. So if you want to prepare for any critical events, I offer additional plans for that. Life insurance. Life insurance is key. You want to make sure that you have some type of coverage to leave for your loved ones. Home care and nursing assistance. I work both with Medicare Advantage plans and Medicare Supplement plans. And keep in mind that if you call those ads on TV, like I mentioned before, on TV or radio, they will sell you the plan that fits the carrier's needs. You want to make sure you're shopping for your best interest and your needs. Like I said, I partner with hundreds of different top carriers to make sure that I'm able to help you find the best coverage for you. If you're interested in a free, no obligation quote, or if you are seeking further information, please do not hesitate to contact me. I hope this video has been helpful in breaking down the difference between Medicare Advantage and Medicare Supplement. If you feel this video was helpful, please hit the like button and share with all your friends and family. Additionally, please subscribe to my channel so you are one of the first to hear of any future educational videos that I will be putting out there. If you have any questions, please feel free to leave them in the comments or contact me via email or phone. I look forward to helping you and your family. Gracias y bendiciones.